What's up, guys? I'm back again with your COVID-19 daily update brief. This is current as of April 4th, 2020, roughly right around 20:30 Eastern Standard Time or local time for me. So today, I want to start it off with kind of what's going around the world and the country here in the United States with some of the big headlines. So President Trump, if you've been following along, the other day he said this is going to be the worst week or the worst few weeks and to expect a lot of deaths. However, President Trump veers from predicting a lot of deaths to now revisiting Easter services and relaxing social distance rules for Easter Sunday. Also, the U.S. will stockpile an anti-malarial drug, the president says. So President Trump appeared to suggest on Saturday that the federal government was placing large amounts of the anti-malarial drug, which is called hydroxychloroquine, in its strategic national stockpile. He spoke optimistically about its potential to treat coronavirus. Now, President Trump has talked multiple times about this magical drug, hydroxychloroquine, especially when you use it with zithromycin. I believe that's how you say it. However, don't expect this to be the magic bullet, the magic drug. Don't just go out and stockpile hydroxychloroquine yourself, guys. The CDC warns against it. There's some fatal side effects to it. There was actually a guy recently back on March 20th that decided to take hydroxychloroquine because he thought he had coronavirus and it did kill him. So our country's flattening the curve. This is actually something I wanted to talk to you guys today about, so I'm actually glad it was one of the headlines. Uh, so as we see here, total coronavirus deaths for places with at least 25 deaths over time. I used to show you guys this graph. I haven't actually gone back to it over the last few updates. I wanted to kind of look at it maybe once a week so we can see the difference. But if you guys look at Spain and Italy, I mentioned about 3 to 4 days ago that we were starting to see both countries start to flatten off, especially Italy. If you see according to the graph here, it now really depicts how it's starting to plateau, right? However, guys, this is going to be a long plateau. Don't expect the numbers to just drop magically like China did, right? Uh, Remember, the CIA recently said that they had some intel saying that China's numbers were fudged. But again, expect this to last for the next month to 2 months, a really long plateau. It's going to take a long time for the death rate to continue to drop down to a manageable number for the healthcare systems and for the country. So again, don't expect that to just be instant. It's going to be a long run. And last, just like in Italy, COVID-19 is pummeling New York hospitals, and the apex to the crisis is just days away. Guys, Governor Andrew Cuomo said that the state is counting on 85,000 healthcare volunteers. What that looks like is out of the 85,000, 22 of those volunteers are from out of state. And then they're expecting to do a major redeployment of doctors that's already underway. So many specialists like neurosurgeons and dermatologists who typically aren't in intensive care wards are going to be pulled from their normal wards and put into intensive care wards to help out with the COVID-19 patients and the influx that they expect to have for New York over the next week or two, right, as we hit that apex. So that's the major headlines, the news, kind of the things that I like to talk about that I think is interesting or we should touch basis on. So let's go ahead, guys. We're going to jump into the numbers. Let me just switch my screens here. All right, so we do have some good news today. It's not all bad news. Total cases and total deaths overall have dropped as far as the percent growth and then the overall numbers. Now they're still going up, right? Uh, Total cases yesterday went up by 100 something thousand. Today they went up by 84,000. And total deaths yesterday was about 6,000 death growth, and then today it's 5,500. So that's what I mean by they're going down. Um, But again, it's still a big increase, and I don't expect that to continue over the next few days. It could just be today, or things could be slowing down just because we're seeing it slow down in Germany, Spain, and France, which are major contributors. Uh, so I made on the key assumption back on the 28th that we would hit 1.2 million deaths by the 4th, which is today. We hit 1.2 million deaths. Right now, the uh, world confirmed cases is growing about every 7 days from what I'm seeing. So we can make the assessment today on the 4th that it'll hit 2.4 million deaths. 0.2 million by, what is this, the 11th, I believe. So we'll say that by the 11th, the confirmed cases will rise to 2.4 million. Again, I'm not too concerned with confirmed cases, guys, global confirmed cases. However, since we're tracking it, we'll continue to track it. I also said on by the 4th that Italy, if it had remained growing at the exponential growth that it was doing at the time, that it would hit 18,000 deaths by today. Luckily, that's not the case. Their measures are working, their quarantines or lockdowns, so we're at 15,000 deaths. So like I mentioned yesterday in my video, I'm not actually going to continue to track Italy because they're now at that plateau. We'll continue to track them down here, but for key assumptions, I'm going to start tracking the UK since they're the ones that are starting to spike and grow at an exponential rate. So UK right now is at 4,313 deaths, 4,313. We're going to assume that that will double, and I'll type this in after the video so you guys, you don't have to watch me type it in, but we'll assume that it's going to double in the next, let's say, 4 days by the 8th, because I believe they're right around 3.5 days right now to 8,000. And then the next key assumption, expect US to pass Italy and Spain in total deaths by 12 April now. And the reason why that is if you look down here, guys, uh, all these numbers, the United States had a drastic drop. I don't expect that to continue to happen, but again, I'm updating this real time as we see it, right? So Spain and Italy are at 7 and 5% over the last 24 hours. United States is at 14. So average them out. If that continues, we won't see that until the 12th now for the United States to pass Italy and Spain in total deaths. And I'll show you that here in a second. But one thing I want to highlight, guys, is in the past 5 days, right? So average over the last 5 days, I'm going to make this small actually for a second. The United Kingdom has a higher growth rate than the United States over the last 5 days. Over the last week, the average growth rate each day for the last 7 days, they're only 1% off from each other. However, since inception, since the first 100 deaths, guys, this is the first time this has happened. The UK has passed the United States right here as far as the daily growth rate of coronaviruses. So the United States was leading this category for the last week, and as of today, the UK has just passed the United States. So we're going to continue to watch that, and that's why I mentioned a second ago that I want to start monitoring the United Kingdom as they continue to grow. But right now, case fatality rate did drop by another percent. It's down to 6%, which is good. We're going to go ahead. We're going to jump into the critical and serious patients, guys. Some more good news for the countries that are possibly flattening the curve. Not so good news for the United States. So for the first time ever, Italy has posted serious slash ICU patients a decline for the first time ever. So yesterday they were at 4,068. Today they're at 3,994. First time that has happened. All the other countries have gone up by a couple of hundred, as to be expected, right? Uh, However, guys, if you look at the United States, they went from 5,787 to 8,206. Astronomical growth. That is insane. That's why I don't expect this number over here, the 14%, to stay 14% because this was such a big increase. This could just be an outlier for today. We'll check it out. We'll see about the next couple of days if that is the case. But again, I don't expect us to continue to have 14, 15% growth rates anytime soon. So good news for Italy. That's the first time ever. Terrible news for the United States. I think that is the most patience that a country has had that is considered severe or critical. I'm going to go ahead and delete this for now. So I think that's everything that we need to touch base on countries, guys. All the important stuff. We're going to go ahead. We're going to jump into states now. So again, we'll look at all the states to include New York, and we'll jump into the other states. But New York is at 1,000 or 114,000 cases currently, with 3,565 confirmed deaths as of today. Going down into the states that are just below New York down here. Louisiana is the only state now doubling every 72 hours. That was the same for yesterday. They continue to be the only one doubling today for confirmed cases. However, some things have changed as far as confirmed deaths, which is another good thing. New Jersey, Connecticut, New York, and Florida are the only ones that are doubling every 3 days currently. And then New Jersey had the highest growth over the last 24 hours at 31%. So they went from 646 deaths to 846 deaths. But I also want to uh, have you guys see here that some of these Michigan, Louisiana, Illinois, and Massachusetts, they're not spiking like New Jersey, and they're not like Michigan's not spiking as bad, right? It's starting to look like it's flattening a little bit. So that could be because we have major lockdowns in place, uh, and they're bringing basically uh, restrictions, right, and quarantines. So that could be working. So again, I'll be curious to see if that is just a fluke thing that's happening today or if that's going to continue. And then here's my projected growth, guys, right? So I said that on the 8th, expect US to pass Italy and Spain. However, it is the 12th now. If you're curious, that looks like it's going to be anywhere from 21,000 deaths to 24,000 deaths on the 12th. If we continue at today's growth, which I don't expect to happen, I expect that to change over the next 24 to 48 hours, and we will update that as is. What I also want to show you guys, I'm going to load it up here, is let me make this. Let me see if I can bring it over. All right. Is when I was talking about the countries or the states, excuse me, that have a statewide order or partial order for parts of the state or the city, right? So 41 states currently have shelter in place orders across the entire country. The only ones that don't are North Dakota, South Dakota, Nebraska, Iowa, and Arkansas. If you look here, Wyoming, Utah, Oklahoma, South Carolina have partial statewide orders, right? Or order uh, or shelter in place orders, excuse me. So South Carolina, for example, only has a shelter in place currently in the cities of Charleston and Columbia. So it is going to be interesting or curious to see what happens to these states over the next week or two as the apex continues to rise and as we continue to get closer to that apex here in the United States. If countries will change their opinion and order statewide shelters in place, right? So California was the first one to do it back in the, I believe it was the beginning slash towards the middle, maybe second week of March, and that's done drastic measures for them since they did that. So again, we will continue to track this and see what happens with these states that do have either partial order in parts of the state or a statewide order shelter in place. So again, that is the COVID-19 daily update today for April 4th. Hopefully you guys are enjoying the videos and the information that I'm providing all in one area. If anything is inaccurate, please leave a comment. Let me know if I misspoke or said anything wrong. Uh, if not, I will catch you guys tomorrow with your next COVID daily update.